space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community.
Okay, welcome everybody to the Khan Health Hour on the 24th of May. We were enjoying the sun. It's rained, or at least where I'm where I am, but I hope it's nice and warm where you are. So my name is Dr. Ayo. I am a fan of Khan, first of all, but I'm also a consultant in acute medicine. I'm going to be your host today. Thank you, everybody who is joining live, and thank you for everybody who has given us the opportunity to watch this on YouTube. Please, we'll be very interested in knowing where you're listening from. So if you can in the chat, please just say where you're listening from. We're really interested to make sure that the message is going out to everybody. So put it in the chat, where are you listening from on a wonderful day. Thank you for taking the time and taking the initiative to be really interested in your health. So I have the pleasure, we've got Sheffield. Anybody else? Where you listening? Salford, fantastic. I'm in Manchester. Hugh, Manchester, that's close to me. Fantastic. Where else are we listening from? Where are we watching from? Dagenham, nice. Dagenham, fantastic. And I've got to say a special shout out to our international medical students who have decided you're in the country, you're outside, and you're learning about whatever you're learning, but you're also taking your health very seriously. A phrase that was really important to me a number of years was, we have to take better care of ourselves. All the words in that sentence is really important. So this is the we. And thank you, Khan, for creating this platform. Have to take better care. We have to take responsibility. You could have been still sleeping. It's Saturday morning, but you decided to join us. We are very, very, very grateful that you are here. Thank you so much. Now, I have the distinct pleasure today to introduce a colleague of mine. Dr. Zainab is a medical doctor who is interested in development and keenly interested in public health. She's got a passion about reducing health inequalities and believes every individual deserves a chance to live a healthy, fulfilled lifestyle. So I'm already excited because I resonate with a lot of that. She is currently the health inequalities lead at the Stroke Organization. So we're not bringing you small fry. We're bringing you people who are at the high level. She's working for a national organization, and she's in charge of health inequalities. And she supports stroke survivors to rebuild their lives after a stroke. We had a conversation before the session, and she was saying that she's really helping the organization even come to terms with the fact that there are health inequalities and moving that situation forward, because a lot of organizations might not even have been aware that where these issues are. So we are privileged to have Dr. Zainab come to talk to us about stroke. So Dr. Zainab, you are very welcome. I'm going to hand over to you and take some notes.
Okay, thank you so much for that kind introduction, Dr. Ayo, and thank you to Khan for, providing this platform to have such conversations. We're going to be talking today about stroke, a condition that devastates so many individuals every day, particularly in our community, but it's something we often don't talk about as much as we should. So please give me a few minutes while I share my slides. Great. Can you see my screen?
We can.
Thank you. So I'm going to be talking today about stroke, what a stroke is, the types of stroke we have, the effects of a stroke, how to spot a stroke, how to prevent a stroke from happening in the first place, and then what kind of support and recovery is available for stroke survivors and how to take action on stroke. So to start with, what really is a stroke? I don't know if you could just type what you know about it in the chat box, but I'm going to be sharing an animation shortly that from the view of a stroke survivor that describes what her stroke was like and the effects that it had on her.
What is a stroke? What happened to me changed everything. It changed the way I think, the way I move, and what I'm able to do. I'd had a stroke, an ischemic stroke. It's the most common type where a blockage cuts off the blood flow and oxygen to your brain. Part of my brain had just shut down as a result. There is another type, hemorrhagic stroke, caused by bleeding in the brain.
Oops, sorry. I don't know what I just did. Can you still see my screen?
No, now we're seeing you. You might need to share it again.
What is a stroke?
Okay.
We can hear it, but we can't see it.
Um,
While we're waiting for Dr. Zainab to sort out the technical issues, maybe you can send some messages to your friends. This is going to be a great session. I don't know whether you want to share the live YouTube streaming. And feel free to ask any question. This is a safe place. And put them in the chat, and we'll make sure that Dr. Zainab has the opportunity to address them afterwards.
I really don't know why, for some reason. Um, Let me see.
You're on mute now, Dr. Zainab, so we can't hear you.
Oh, sorry.
I
I
don't know
said a moment, please, while I try
yeah,
to sort out my technical issues.
no problem.
No problem. Again, while we're waiting, it's a great opportunity to ask your questions in the chat about a stroke. If you know anybody who's had a stroke or anybody who's dealing, a family member who's had a stroke, we can see your screen now, Dr. Zainab.
What is a stroke?
Yeah, we're back on. Please,
What happened to
you can
me?
send this message into your WhatsApp groups. It's a great opportunity to let people know. Okay, I'll hand back to you, Dr. Zainab.
Thank you. Sorry about that.
Everything. It changed the way I think, the way I move, and what I'm able to do. I'd had a stroke, an ischemic stroke. It's the most common type where a blockage cuts off the blood flow and oxygen to your brain. Part of my brain had just shut down as a result. There is another type, hemorrhagic stroke, caused by bleeding in the brain. Any stroke can be life-changing, and it can happen to anyone of any age. Stroke affects everyone in different ways. For me, it was my sight, my speech, and weakness on the right side of my body. I lost part of my vision. Talking became hard because I just couldn't find the words to describe things, and I struggled to walk more than a few steps. I was so exhausted all the time with just no energy to do normal, everyday stuff. Remembering things and concentrating became almost impossible. And I couldn't read much or even write my own name.
So that's stroke survivors' experience of what a stroke was like. And this is the experience or something similar of about 240 people who wake up to a stroke every day. And within our community, many times we think about a stroke as something that affects elderly people, or it's a condition of the elderly, someone in the 70s, in the 80s. It's not really my problem right now. But anyone can have a stroke. Moms, dad, grandparents, young children. even babies as young as a few days old can have a stroke, and it can leave stroke survivors being unable to move, to speak, to swallow, to do different things that we would normally take for granted. So, what is a stroke? What happens when you have a stroke? A stroke is a brain attack, sort of how you would say someone has had a heart attack when it affects the brain, the heart rather. But when it affects the brain, it's called a stroke. It happens when there is a disruption in the blood supply to a part of the brain. So depending on what part of the brain is affected, that's how the manifestations of that stroke would be. So like the person said, she lost her vision. So most likely it might have happened at the back of her brain, for example. There are two types of stroke commonly, the ischemic stroke and the hemorrhagic stroke. There are other types, but they're not, we won't be talking about that in this presentation or in this conversation. An ischemic stroke is more common. It occurs when there is a blockage or disruption to blood flow to the brain. So let's imagine it like your plumbing system. You have those pipes that bring water to your tap every morning. Imagine that a rock comes from somewhere, maybe a construction site around, and blocks one of those pipes. And then you open your tap and nothing is coming out of that tap. That's similar to what happens in an ischemic stroke. So there is something blocking the blood vessels that would bring blood to a distant part of the brain, and that manifests as a stroke. It could be that something is blocking it, or the blood vessel got narrow. Either way, it's a form of blockage. On the other hand, a hemorrhagic stroke is a bleed. So imagine those same pipes underground, but instead of having a rock block it or something compress the pipes from outside, the pipe burst open. So when you open your tap again, nothing comes out. So that's what happens in an hemorrhagic stroke. There is a burst of the blood vessels within the brain or with the covering of the brain, and as a result, there is no blood supply to the places that that vessel would normally have supplied blood to. And this is what happens that results in a stroke coming to place in the first place. Now, there's also something we call a mini stroke or a TIA. It's similar to a stroke in terms of how it happens. So it's when there's a disruption of blood supply to the brain, the eye, or the spinal cord. And as a result of that blockage, you also notice that there are disruptions in the person's ability to do some things. But unlike a major stroke or the normal stroke, a mini stroke doesn't last for long. So it's usually between maybe an hour and 24 hours, the person would notice those symptoms. But if you notice anything, it's not your decision to make and say, oh, let's see if this is a TIA or if it's a major stroke. No. Once you think you're having a stroke, you do what you have to do. We're going to talk about that a bit more soon. So what are the effects of a stroke? We said that when it happens, when there's a blockage, there's a disruption of blood supply to a part of the brain, and that affects how the person is able to perceive things. And the effects of a stroke can be physical or things that you cannot see. Many times we think of a stroke as, oh, the person can't lift their arm or their legs, or maybe they can't see. But there are other effects of a stroke that do not manifest as those physical symptoms we're really used to seeing. And for every individual, how they experience a stroke is very unique to them. For some people, it's going to be loss of their memory and concentration, or changes in the way that they behave or their emotions or how they process or think about things. For some people, it's just general fatigue. And this is something that is seen in many stroke survivors. There is just this overwhelming tiredness that doesn't get relieved by resting. Joint pain, numbness of the skin, and inability to feel maybe hot temperature, cold temperature, or vibrations are some of the things that a stroke survivor can experience, either short term or long term. Problems with balance, problems with leg weakness or hand or arm weakness are things that could also happen. Bowel and bladder control can be lost following a stroke as well. So the person may begin to experience some forms of incontinence. So we can see that a stroke can affect any part of the system, like literally from head to toe. So let's take it out of our minds that, oh, it's just physical. Many effects of a stroke can even be emotional. People having depression, anxiety following their stroke. And these are the hidden effects, like the things we wouldn't normally see, but the stroke survivor is experiencing when they do have a stroke. So how do you spot a stroke when it's happening immediately. Like the things we just spoke about are things that a stroke survivor may experience long term, months, days, years following their stroke. But in the acute phase, when a stroke is happening at the moment, how do you know it is happening? There's something I want you to put in your brain, like memorize and take out of this presentation. Fast. When it comes to stroke, just think fast. FAST is an acronym that describes the symptoms or signs of a stroke. So, what you may experience as a person having a stroke, or what you may see in a person that is having a stroke as an observer, you may witness this in someone. F stands for facial weakness. So if you're looking at someone or you're speaking or you are the one experiencing it, you notice maybe a droop or change in your smile. So it seems like your face is shifting to just one side, or the eyes are drooping, or when you frown, you notice that just one part of your eyebrow that goes up, the other part isn't going up, or one part is wrinkled, the other part isn't wrinkled. That should point you to the fact that there is some form of facial weakness going on. A stands for arm weakness. Weakness in the arms, paresthesia, or paralysis, and inability to even lift up the arm at all. So it could be the arm, it could be the leg, or one side of the body, like both the arm and the leg happening at the same time. So can the person raise both arms? In a stroke, you would notice commonly that the person is experiencing some weakness in one of the arms. Same with S being speech problems. Can the person speak clearly? Many people who are experiencing a stroke may come up with a symptom of slurred speech. So their voice just changes, the way they speak changes, or they're suddenly unable to pronounce common words like table, bed. Suddenly, something they could pronounce a few minutes ago seems very difficult for them to pronounce. Any of these things either happening as one, like one of the three, or two of the three, or three at the same time should make you think of a stroke, and please act fast. Time is of essence when it comes to stroke. It's time to call 999. This is not a time to say, oh, let's see if it will get better. Oh, my arm is feeling weak. Maybe I should sleep and then when I wake up, I'll feel better about it. Or I should wait for someone to come home and then we can talk about it. No, time is of essence when it comes to stroke. For every minute that is lost in a stroke, 1.9 million cells of the brain are dying. And this could worsen the person's ability to recover or the kind of symptoms the person will have. So please, when it comes to stroke, act fast because this is very important for stroke survival and for recovery. Okay? And then, please, another thing I want to stress here with in terms of fast is don't think that you want to drive to the hospital. It's not advisable. Calling an ambulance is your best bet because your car is not an ambulance. You're not a paramedic. Anything can happen while you're driving. Your condition can deteriorate. You can get stuck in traffic, or you have to get to the emergency center and start explaining what is happening to you. But once you call 999, whoever is on the other end of the phone already knows what is happening to you, and that it kind of triggers a process within the health system that helps you get the care you need as soon as possible. There are other symptoms of a stroke. So the ones I just mentioned are the most common symptoms. So the facial weakness, the arm weakness, the changes in speech are things that we would see commonly. But those are not the only signs of a stroke. For, like I said earlier, it affects people differently. Everyone's experience is very unique to them. So for some people, it may be blurred vision, a loss of their vision, some form of memory loss or confusion, or a sudden fall. And for many people, some people also describe what they're experiencing as the worst headache of their life. So that sudden, severe headache could also be something telling you that a stroke might be happening here, commonly a hemorrhagic stroke. But so if you experience any of these things or you notice this in somebody else, it may not even be your loved one. Like you're on the road, you're watching somebody, you're in a supermarket, you're talking to someone, and the person suddenly, slumps or, has that slurred speech or the face, you just see it deviating to one side. Please don't wait. Call 999 immediately because every time you save is brain cells being saved. Now, we've talked about what a stroke is, the effects of a stroke, how to spot a stroke when it's happening, like in real time. But what can you do to prevent a stroke from happening in the first place? Now, at the Stroke Association, we advocate a lot for stroke prevention because every day we see how it devastates the lives of stroke survivors. And within our community specifically, it's really important because for as people of Black and Afro-Caribbean background, we have a 1.5 to 2.5 times higher likelihood of having a stroke as compared to other people from other ethnic groups. So we need to take prevention very seriously. Similarly, for many ethnic groups, they have their strokes, when they're elderly, in their 70s, in their 80s. But in our community, we're seeing that we have strokes at an earlier age of onset, almost an average of about 5 years. So people within in their 40s, in their 60s are having strokes, before other people. And then another thing that is really putting us at risk is that within our communities, hypertension and diabetes are very common. We're more likely to have these conditions that are predisposing factors to having a stroke in the first place. So what can we do? Now, before we go to what can we do, I would like to talk about what causes a stroke. These causes are also referred to as risk factors. Now, there's something we call modifiable risk factors and non-modifiable risk factors. Modifiable risk factors are things we can do something about. Non-modifiable risk factors are things we can't do anything about. You can't change your age. As you grow older, the likelihood of having a stroke increases. Your family history of a TIA. So if there's someone in your family, maybe your uncle, your grandpa, your brother, your sister, that's had a stroke or a TIA, that's the mini stroke, or a heart attack, or has any cardiovascular disease, the likelihood of you having a stroke is higher. But there's nothing you can do about the fact that your grandfather had a stroke. So that is out of your control. It's a non-modifiable risk factor. Ethnicity, because we are blacks, because we are from, the Afro-Caribbean ethnic group, the likelihood of us having a stroke is higher due to some genetic factors. We can't change that. We can't change our genetics. But there are things that we can do something about, and these are lifestyle factors and health problems. So smoking, being overweight, use of recreational drugs, drinking too much alcohol, being inactive are things that can cause a stroke. Similarly, health problems, so any cardiovascular disease, really, hypertension, that's high blood pressure, having irregular heartbeats, having diabetes, high cholesterol, or sickle cell disease that is quite common in our community. These are all conditions that could predispose someone to have a stroke or could directly cause someone to have a stroke. We won't go into the pathophysiology of how it happens, but these are just things that could lead to someone having a stroke. So for the things that are within our control, how do we control them? The first thing I'll talk about is alcohol, drinking alcohol. Now, previously, people used to say, oh, if you take a glass of red wine every day or something like that, it's cardioprotective. Unfortunately, I'm so sorry to break the news, guys, but there is no amount of alcohol that is cardioprotective. That's what new research is telling us. So, even if you're not going to stop drinking, you need to cut drinking alcohol to safe limits. And for the UK, the safe limit is 14 units of alcohol. That's about 6 pints of average concentration beer. And the recommendation is to actually not take it all maybe in one day. If you can try to have like 3 days within a week where you are alcohol free, that's the best. That's like something to aim for. But essentially, drinking alcohol within safe limits reduces your risk of having a stroke. Smoking as well. Smoking is a risk factor for so many conditions: hypertension, diabetes, cancer, stroke. So if it's possible, please stop smoking. Try to get help to stop smoking. And there are so many smoking cessation services available within the NHS that one can make use of. Staying a healthy weight is also a way of reducing your risk of having a stroke. Now, what is defined as a healthy weight? It's quite controversial, but commonly what we use is the BMI. So that's measuring your weight and your height and then trying to calculate what the values are. You can do that using an app. So there are many apps that you can just put in. You can just even Google it, what's my BMI, and put in your height and your weight, and it will calculate it for you. And then you can now strive to see if you could be of a healthy weight. If you would know if you're of a healthy weight, and then you can take steps to determine, like, to reduce your weight or be of a healthier weight. And the things we've said so far are things that actually, if done, would help you lose weight. Eat a healthy diet. Now, many times when we talk about healthy diet, we'll say, no, greens. I'm not a goat, I cannot eat grass. No, that's not it. Or, oh, you're telling me to just drink olive oil. No, within our current diet as Afro-Caribbeans, we can make our diet healthier. A lot of our foods are actually very high in fiber. So our maize, our millet, guinea corn, and so on that we eat, they're very high in fiber. We eat a lot of vegetables, but we can make our diet healthier by reducing the amount of salt we put in our food. As Afro-Caribbeans, we tend to season a lot. We use bouillon cubes, then we'll add salt, then add oyster sauce, then add so many other things. Reducing salt is one of the, low-hanging fruits if you're trying to eat healthy. Similarly, the way we cook our food, we like to fry as Afro-Caribbeans. We like fried plantain, we like puff puff, we like fried chicken. But when you fry your food, it actually increases the amount of fat within your food. So if you can try to modify your cooking methods, go with other things like, smoking, sorry, not smoking, grilling your food, boiling or steaming your food, or even using an air fryer, it's going to give you that fried taste, but without that amount of oil. And also when we take staple foods, I know the diets very, very differently across Africa and the Caribbeans, but I know that for some of us, we eat what we call swallow, so fufu, eba, or cassava, and all those things. When you're eating those kind of meals, the aim is to have the vegetable or the soup as the main meal and the swallow as the accompaniment. So your swallow shouldn't be more than your fist. So reducing the amount of swallow and increasing the amount of vegetable are easy ways to make our diets that we already eat as Afro-Caribbeans healthy, rather than now trying to incorporate new things into our diet. Of course, fruits cannot be overemphasized. Eat your fruits as much as you can. Aim for 5 portions of fruit in a day, and those are ways to make your diet more healthy. So the cooking methods, reducing your salt intake, and then the portion size as well. Being active as you can help reduce your risk of having a stroke as well. And it's not about, having a gym membership. You can stay active within, what you already do, or making some extra effort. So for instance, running in your neighborhood. If you cannot run, try to jog. If you cannot jog, try to walk. If, for instance, your neighborhood is unsafe or the roads are too narrow, there are so many exercises that you can do within your house, or the ways that you can modify your day-to-day activities so that you're more active. So instead of sitting down during meetings, you can stand as if you work from home, or instead of, taking a car or a bus to the grocery store, you walk to the grocery store as well. But just try to aim for about 30 minutes of moderate exercise 5 times a week if possible. Dancing is something we do a lot in our community. Dancing can be a form of exercise as well. Wake up in the morning, set your alarm clock for 15 minutes in the morning, 15 minutes in the evening. Dance out your problems in the morning and at night as well. Make sure you're sweating, your heart is racing, and you're feeling warm. And those are forms of exercise. So dancing is a form of exercise as well. Walking, skipping, you can skip in your house, you can jog on the spot, being as engaged as possible. Taking the stairs when you go out rather than taking the escalator are ways of, increasing your activity within a day. An important thing that we must also do to reduce our risk is regular health checks. If you're above the age of 40 and you're living in the UK, you are entitled to NHS health checks. And these NHS health checks are very important. They are an opportunity to kind of pick up on things before they go out of hand. So picking up on hypertension, diabetes, all those conditions that we spoke about earlier that predispose one to having a stroke are things that can get checked on NHS during the NHS health check. Unfortunately, members of our community are one of those that make up the lowest number of people who go for their health check. So within our community, we're not making the best use of this opportunity. And for people who have a chronic health condition as well, so if you've already been told you have hypertension or diabetes, these are chronic conditions. Sickle cell disease is also a chronic condition. So please try to go for your annual checkups. Also monitor your health at home. I know that for some people, going for these health checkups can be a bit daunting. You may be wondering, oh God, I don't want to go. I feel so intimidated anytime I go for a health checkup. Please, as individuals, as Blacks, as Afro-Caribbeans, we need to take charge of our health. We need to put ourselves first and do what is best for ourselves. So if they give you an appointment that is not working for you, advocate for yourself. Call the hospital back. I'm sorry, I'm going to be at work at this time. This is the time I'm available. Does it work? So the fact that they told you that you have to come on Tuesday at 9 a.m. and you have a meeting at that time, it's not cancelled for you if you can't make the appointment. You can call them and tell them that you need something else, as I need some other time as well. And going to your appointment, you're not going there as a passive member of the conversation. You're an expert in your experience. You're the one that knows yourself. The doctor is an expert in medicine, or whatever condition you're being treated for. But you know what, is most important to you and what your needs are. So go to that conversation armed. Go to that conversation with questions. What am I being treated for? What are the medications you're giving me? How long is this condition going to last? What are the side effects of the drugs you're giving me? How do I know that my condition is deteriorating? Who do I call if my condition is deteriorating, or what do I do? So go there with questions. If you can't even remember them, write them down. Google whatever it is, not Google, sorry, go to NHS, the patient info on NHS, and check all the things that are associated with your condition so that you're going into that conversation armed and informed, and you're able to speak for yourself if things are not, if you're suspecting, oh, this conversation isn't going the way I want it to, or I have questions, or I have concerns, you're able to pick up on that and speak. And if you're someone who still feels intimidated despite this, you can go for your appointments with somebody you trust. So a friend, a family member, so that person can advocate for you. But we just need to do more in terms of taking care of ourselves, taking charge of our health, and literally just advocating for ourselves, because nobody's going to do it for us. Let's be honest. We need to do it for ourselves. But very importantly, we need to take our health checks more seriously. And outside of, going to your GP surgery, you can actually have your blood pressure checked at a pharmacy. So maybe after this, I'll drop some of the links in where you can search what pharmacies around you are providing the blood pressure checks for free. So if you're above the age of 40 and you don't currently have a diagnosis of hypertension and you live in England, you can walk into some pharmacies and have your pressure checked free of charge. So these are things you can just do so you understand your risk as well as how to reduce them. So we've spoken about, what strokes are, how to reduce your risk, but what happens after you've had a stroke? What happens if you're a stroke survivor or a loved one of someone who has had a stroke? The message here is that recovery is possible. Through support, strength, and determination, recovery is actually possible. Stroke recovery is long, it's hard, and it's painfully slow, but um, like we'll come to know later when we hear from the persons that have had lived experiences of stroke and the videos that we're going to play later on in this conversation, you would know that recovery is possible for a stroke survivor. So that's we have this fatalistic view of strokes in our community. We think, oh, once one has had a stroke, that's the end. Like there's no moving on from it. But really, there is. With strength, with support, with determination, you can actually recover. And that's something we hear a lot from our stroke survivors that we support at the Stroke Association. Many of them tell us that, their family, their friends, and just the general support they got was what pushed them to, take that next step. And that's why we are here. Like that's the Stroke Association. That's why we are here. We're a leading charity that supports stroke survivors all through their journey and lifelong. And we exist because tens of thousands of people have a stroke every year, and they need the support that that we provide and the other people around them provide, really, to be able to make that recovery. And we're able to provide that support to stroke survivors through our tailored services. We have a one-on-one, we have one-to-one groups, we have a helpline that people can call as well to find out more about a stroke, what medications they've been given, and just understanding how the stroke has affected them and how they can overcome those challenges. On the helpline as well, sometimes you just need somebody to talk to, just someone who understands what the effects of a stroke, who understands the stroke journey. And that's one of the things that our helpline also provides. We also provide research. We do research in stroke, and we also campaign for better care along the stroke pathway. So these are the ways that we provide support to stroke survivors to recover following a stroke, in addition to all the support that the wider health system provides, their family provides, and their social support system also provides to them. So, taking action on stroke, this is just me talking about the ways that you can work with the Stroke Association to to help more stroke survivors, reach more stroke survivors, and just spread the message about stroke. One, you can volunteer with us, our BAME support group. So we have a Black and minority ethnic group It's an online peer support group. We are currently taking volunteers, but it's also an avenue for people with lived experience of stroke from the Black and Afro-Caribbean communities and other minority ethnic group communities, really, to have that conversation, share their stories, share the support that they have received or would like to receive, and just, give themselves that peer-to-peer support that they need. You can also share our posts on social media, our campaigns as well, because very often we campaign for different modifications or quality improvements on the stroke pathway. So, if there are three things I want you to take out of this presentation today, they are that one, a stroke is preventable, it's treatable, and it's recoverable. Two is fast. You need to act fast. When it comes to a stroke, you need to act fast. Facial weakness, arm weakness, slurred speech, and then time is of essence as well when it comes to having a stroke. Thank you so much, everyone, for listening. And then I'll pass it on to Dr. Ayo to continue with the session.
Wonderful, wonderful, wonderful. Thank you so much, Dr. Zainab. That was a tour de force summary about stroke. I've been making some notes. So I really, really liked your points that you were making, the things I've said here. I love the tap analogy of helping people understand what the issue is in terms of blockages. The way you stress, look, in the moment, it's not your decision to decide is it a stroke or is it TIA. Just get checked out. I love that. I love the conversation about, the fact that stroke might affect things that are more than physical or things that we can't see. Not all disabilities are visible. And again, I love the charge, which is one of the things that I think has been a consistent thing on these Calm Health Hours, to encourage people who are listening to take responsibility for your health. The person who will be affected, God forbid, if you have something, is you. So why not your family, not the doctors, not the healthcare services, you. So you, and if it has happened to you, or it's you that, or you're worrying about it, you have to take responsibility for it and change something. And I love, as a doctor who works in the health service, I love it when people come to me with questions because it means that they're engaged and they're taking it seriously. So the list of questions you had for a doctor, don't worry about, maybe I'm bothering the doctor. No, a doctor who really is in charge of, who really is in wanting the best for their patients will have the time to answer your question. So again, Dr. Zainab, that was wonderful, wonderful, wonderful. Well done. Sam, do we have the person to come and do the lived experience, or would you like me to?
Go ahead, sir. You should talk about your.
Wonderful. So, spoiler alert, I had a stroke in 2020. So I am a consultant in acute medicine, and at the time I was 39. So all you budding mathematicians can figure out how old I am now. I was at work, and I had some symptoms, some mild symptoms on my left side. I had some weakness. I had some pins and needles. I actually didn't take Dr. Zainab's advice, so I drove home. And then I went to a stroke center and I got diagnosed with a stroke. Now, this is the brief version. There is I've done a long presentation about my experience, so please have a look at Khan's YouTube page. The things I wanted to say that really relate to what Dr. Zainab was saying is the emotional weight of having a stroke. So I was 39 and I'd had a stroke. And as a doctor, I am aware that having a stroke increases my risk of cardiovascular problems in the future. So I'm like, does that mean am I gonna have another stroke? Why did I have a stroke? I'm not even 40. And I'm having to do all this mental gymnastics and really wrestle with it. And I am grateful for the journey that I had been on up until that point. Plus my very supportive family, plus my wife and I decided to engage in therapy because that year I had a stroke and my dad died. So our family was really dealing with a lot. So we engaged in talking therapy because I needed to reconcile these things in my head. And I can imagine that somebody who doesn't face it intentionally, these issues will still be inside you. The wrestling and the mental gymnastics will still be happening inside you. And that's part of the reason why people really struggle with it, especially people who are young. So questions like, okay, so am I going to have another stroke? Do I need to live in fear of another stroke? Am I going to live in fear about having a heart attack? Because cardiovascular means blood vessels around around your body. What about my relationship with my wife and my children? I noticed that it affected my children. So now daddy's had a stroke. So, are they more health conscious? Are they all these kinds of things really happen? How long is it going to take for me to recover? What does recovery mean? So for instance, I'm now years later, every now and then I might still have some issues in terms of pins and needles. I know when I'm tired, some of the symptoms that I had at the time can recur. So having to wrestle all that kind of stuff, I had another MRI probably a year later while I was at work because my arm was really weak. All of these kinds of things really bothered me. And again, looking at me, you might not realize that these things are happening in my brain. So it's important that everybody, because stroke is a chronic condition, well, it puts you in a high risk bracket. Immediately I came back to work, I'm black, and I've had a stroke, and I was diagnosed with high blood pressure. So in terms of COVID, I was in the highest of, high risk groups. All of these things really, really, really affected me. So all I'm saying is that I had to get to the point where I faced these issues head on. So the things I started to do was, okay, so let me think about my diet. Let me think about exercise. Let me be intentional about water. Let me be intentional about my modifiable risk factors. Let me deal with those things head on. I could have put my head in the sand. And I think a lot of people who do that, the issue is fear. And again, I'm grateful for the experiences that I've had in life that challenged me to deal with the fear head on. So the encouragement I would give people from the experience is Dr. Zainab saying, not knowing doesn't help anybody. Knowing is armed. Being armed with information and dealing with the emotional weight of the thing and wrestling with the pathology, I think are two separate things, but we have to do both. So I hope that has been helpful in terms of listening to somebody who's had a stroke. I'm grateful, if I'm honest with you now, I'm grateful for the stroke that I had because my life is different in a way that it probably wouldn't have been if not for the fact that I had a stroke. I'm being more intentional with my health than I would have been otherwise. So I'm very grateful to God for that. That's my lived experience. So if it's not yours, and I'm also, these sorts of things. My stroke consultant said to me, some things happen to you, some things happen for you. I also heard somebody say that if you survive a small stroke or a small heart attack, you can live to be a very old man. So what does that mean? I am not allowing the fact that these things have happened to me past tense to be the thing that is in my head all the time. Oh my goodness. No, I'm using that as a springboard to make the rest of my life the best it can be because of what's happened to me. So I hope that is helpful for somebody. So we're going to go to some question and answers. Okay, so the chat is blowing up. And usually what happens with these things is that somebody asks the questions and then, the questions start rolling. And just before we have to roll up, look, 10 million people ask questions. So please, if you have a question, now is the time to ask. Please, 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 please. Okay, so Dr. Zainab, are you ready? Let's have a look. Okay, so a few questions. Okay, so first one, question from our social media. If you were a public health leader, how would you reach Black men aged 35 to 55 with this message? Honestly, many of us don't want to make a fuss or feel like a burden. How do we change that mindset when seconds really matter? How often should you check out your blood pressure? So Dr. Zainab, if you want to unmute yourself.
Yes, so
Yo.
that's a tricky one, but I think this is one of those avenues that we can use in reaching those people aged 30 to 55. These conversations that we're having right now within our communities. And I know that even within other communities, so for instance, the NHS has the community connector, the called 20 Plus Ambassador Program, where people from communities go to the communities that they're from to have these conversations, talking about prevention and risk factors for common conditions. And one of the called 20 Plus conditions is cardiovascular disease, one of which is stroke. So once you're being talked to about, hypertension, diabetes, and all that, it's not just for hypertension. It's not just for that specific condition. It's for a range of conditions that share a similar risk factor. I know that there are also other initiatives that people are doing as well to try to reach people. So like there are these barbershop initiatives where
Yeah.
people have, conversations where barbers are trained on some of these health topics so that during those, casual talks that happen during a salon visit, they can advise people to, do their health checks and talk about things that people would normally want to talk about in the community. So I think these are different ways. It's just about really being creative. Where do these Black men tend to meet? Where do they tend to, feel free and comfortable? And then trying to move those conversations into those spaces. Everybody here now is kind of already an ambassador for stroke. You've heard the information. It's not for you to now keep it to yourself and gatekeep on stroke. So it's only me that will not have stroke in the community. No. Go to your community, go to your friends, have those conversations. And if you need someone to come and speak to you in your maybe little community group or whatever, we have volunteers at the Stroke Association who also do that, and they're spread across the country. And you can also volunteer as well to be a community ambassador. So we have a community connector program within the Stroke Association where we ask for people to step forward that are very close to their communities, and then we give them some form of training, and they're able to go back to their communities to have those conversations, signpost people to the kind of care that they need when it comes to stroke support and risk reduction and recovery.
Fantastic. Now, if I may, as a representative of the SAD group of Black men 35 to 55, I agree with everything that Dr. Zainab has said. If you're on LinkedIn, I think even on social media, there's a gentleman called Jesse who's doing a program called Thursday Night Jollof in London. And just like Dr. Zainab saying, the issue is we need to normalize these kind of conversations. So culturally, we have taken a step back from talking about health. I don't know whether the issue is shame or whatever, and we're not connected in general in that we'll talk about business or women or sports and stuff, but in a situation where it's just men by themselves, we need to normalize conversations about health. How are you, bro? How are you really doing? You know, people say that checking on your quiet friends or your friends who are always laughing, even from a mental health point of view. How are you doing? So I would advocate all of what Dr. Zainab is saying, and you being an ambassador because you are here. I would also say that the NHS in general is learning that what we have to do is rather than ask people to come to us, let's find ways of going to them. So the thing that anybody who's listening to this, what you can do is this YouTube video, find it and send it to people in your community. You can put a lead in, guys. I thought this was really interesting. Or just send it, put it on your WhatsApp status, put it on your Instagram. When you see things on Instagram or LinkedIn or whatever, challenge it. I mean, champion it. Let people see, because even if it's one person who will engage because you said, that's the information getting out to other people. I think that's a really good thing. I think we all have to be ambassadors. How often do you check your blood pressure? So as a consultant, I would say the thing to remember about blood pressure is it changes throughout the day anyway. So I wouldn't check it more than once a day, but I would check it at the same time whenever you're checking it. That's the thing, because as a doctor, the thing I am most interested is the trend. Obviously, if it's a really high, go and see somebody, obviously. But as a doctor, if it's a bit high, the thing I am most interested is a trend. Okay, which of these tips? Okay, fine. Blah, 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 blah. What can be done to raise awareness to GP practices about offering the standard 40+ health screens, especially to Black patients? Some don't offer it due to health inequalities unless patients ask. Dr. Zainab, what can you do about that?
So let me get the question right. What can we do to make sure GP practices are doing the NHS checks?
So offering the standard 40+ health screen. So as you go over 40, this person is saying that there are some things that they would expect the GP to check, but in some places they don't check. How can we encourage that?
Well, that's quite surprising because the NHS checks is supposed to be carried out, once you're above the age of 40. For people above the age of 40, you are entitled to this. So I think if you have a GP that isn't providing these services, it's something you should actually raise within your community because that is somebody perpetrating an inequality that shouldn't exist. That's a deliberate attempt at sabotaging your own health, and you shouldn't be quiet about it. We have Health Watch, we have CQC that, collect information on GP practices and listen to the voices of the community. So these are places you can raise your concerns with as well.
Especially because a lot of the NHS system, they are automated.
Mm-hmm.
So the GP, when you come in, there'll be a message on their screen, check blood pressure, check this.
Yeah.
It's not something that they have to think about. So I suppose the question is, if you feel what's happening is that they are ignoring those things, that's an issue. But it also might mean that if you haven't engaged with your GP, the GP might have 10,000 people on their books. If you don't go, then nothing in the system tells the GP this person who doesn't engage, go and find them. Does that make sense? This is, if you are over 40, go and speak to your GP and say, I would like a health check. And if they decline, then that's an issue where they're withholding. I would like to believe that withholding is what people aren't doing. It's probably they haven't been aware of it. Another question, what might volunteering with a stroke association entail? Are there any opportunities for people under 18? Thank you very much, Julius.
Okay, so I answered your question in the chat, Julius. I sent a link to some of the opportunities that already exist. So there are a variety of opportunities that exist. We have communication support, the community connectors that I spoke about earlier, and so many others. You can also help with setting up peer support groups within your community. So there are several volunteering opportunities. I've dropped a link to the ones that are available within in the chat, but you can also just go to the Stroke Association website, stroke.org.uk, and check for volunteering opportunities as well. For persons below the age of 18, we normally would take strokes volunteers above the age of 18, not below the age of 18, except there are specific things that we're looking for. So for instance, we have a childhood stroke support group. So it depends on what the and for those ones, many times it's bringing together stroke survivors that have had childhood stroke or parents of stroke survivors that had a stroke in childhood. So there are actually a lot of opportunities. So depending on what you're looking for, you may find something that actually does suit you.
Fantastic. We've got Yabo Paseo, who has given me some compliments for Zainab. But Zainab is smart, and I listened and was fascinated by the way you were communicating. Well done. I have a better understanding of symptoms and what can be done to support. But thank you very much for your comments, Yabo. I know that you've answered this in the chat, Dr. Zainab, but for everybody who is listening afterwards, these symptoms of stroke vary with age. Example, how might one with a stroke in a baby or a young child, if they can't speak yet or have full control of their muscle in the first place?
Okay, so for a baby or a young child, so spotting stroke in children is a bit tricky, but one of the things that can be used to spot them is excessive drowsiness or sleepiness, seizures, a tendency for the baby or the child to use just one side of their body, when they're maybe moving, when they're playing and so on. But if you just suspect anything isn't right, and this is besides fast, if you suspect anything isn't right with your child, take that child to the hospital, let that child be examined, and then the doctors can take it up from there. So if you have any concerns about your child, your baby, this child doesn't seem to be, acting the way they normally will. The child is maybe a child that was previously talking, suddenly isn't talking, or you see that it seems like the face of the child has moved to one side of their face and so on. Take the child to the hospital. No, not take the child to the hospital. Call 999. I'm sorry. Call 999. That's what I'm going to say. Call 999, and then you would have the support that you need. They would also talk you through. So depending on what it is, they could ask you some further questions to try to understand what is happening with your child. Yeah.
Fantastic. So we've got a question from Sandra. Quite a long time ago, I did a procedure called a milligram. I'm not sure what that was actually. I had severe pains in my head. Lights were very painful, very strong headache, and needles. Lost the use of my speech. Could not put two words together. Body shut down. I still have problems with memory and I lose words. Forget word. Was this a stroke?
So from what you have said, Sandra, it's difficult to say if it was a stroke or not. I think the best thing would be for you to go to the hospital or report these symptoms to your GP. For some people who have had a stroke, so one of the things we didn't talk about in this conversation was what we call a silent stroke, where a person has, it's picked up only on radiological examination. So when they do a scan, they realize that, oh, at some point the person had had a blockage to a part of the brain and that still exists and is causing symptoms. But that never really manifested in real time for that person. So it could be a couple of things. I really wouldn't be able to give
Yeah,
specific medical advice, but would rather say share these concerns with your GP, and if they need to, they would refer you for further evaluation and see what they can do. And if a diagnosis of stroke is then made, you can get the support you need to, recover from it.
wonderful. I 100% second that. There are times as a doctor in the acute setting where I see patients and we do a scan for another reason, and we find that at some point the person's had a stroke and they weren't aware. So it absolutely can happen. Do men have more tendency to have stroke than women? If yes, why could this be so?
Okay, so in terms of this distribution, yes, men do have a higher tendency, specifically. So the distribution of men, women, it varies with age, to be honest. But generally, we have more men having a stroke than women. If yes, why could this be so? It could be for a variety of reasons, really. I would, I wouldn't be able to say this is or this isn't the cause, but there are several risk factors we have spoken about earlier during the course of this conversation. We talked about smoking, we talked about alcohol, activity, but activity, eating healthy. All these things could come together to increase the risk of, one gender having a stroke as compared to the other because of their likelihood of, engaging in those high risk behaviors or lifestyle factors as compared to the other. And that's just even besides thinking about genetics as well, because genetics is another thing that contributes to one's risk of having a stroke when you compare one gender to the other as well.
Yeah, absolutely. There's a gentleman I follow on social media called Jason Wilson. He is a gentleman who goes around speaking about men becoming comprehensive men and talking about men being what we call emotional incarceration. What that means is a lot of men don't give themselves an opportunity to really talk about how they're doing, which ties into what we mentioned before. Now, what he was saying is that one of the reasons that men don't engage in healthcare is because some men only believe their job is to protect and provide. They don't give themselves or have not been given a framework to have anything else. So why would I want to get health check so that I can just continue to live a life in slavery or drudgery and stuff. So the point he was making is that men need to see themselves as more than just a protector and a provider, and therefore that will give you the impetus to seek help and checks. And you're not just here to be of service to other people, to your wife and your family. You're here to be a comprehensive man and enjoy life. And so please, if you are studying my brothers, engage, have a conversation with somebody. Then we've got a conversation here. Another question. So this is Deja. So working in healthcare, I've noticed that some of us are not using our real age, we're using our football age. Considering the structured UK system where we use guidelines, a person who is less than 40 officially, but actually over 50 in reality, may not get necessary or appropriate management. This is also one of the reasons why people are denied over 40 healthcare, as the system shows that they are less than 40. What do you think? Is this the papers issue?
Well, that's a dicey one because, you know, the NHS, the system doesn't know that you're using a football age. It's what they see they're going to make use of. So it's if you say you're 50 on paper, but if you say you're 40 or you're 36 on paper and you're 50 in reality, it's going to be very difficult to make a case for, you getting the NHS checks. So in such cases, it may be that you may need to, seek some private health checks, for instance, if it's possible, or get your own blood pressure machine. That's something we didn't mention earlier. You can actually get your own monitor and check, like Dr. Olatoye had described earlier. But then you're just going to be checking for hypertension, like high blood pressure when you have a monitor. An NHS health check is more comprehensive. You're going to be screened for, your weight, your height. You do some blood tests as well. So it's if you feel like if you know that you're in your 50s, but um officially it says you're in your 30s, it may
Yeah,
be worth you just making that spend of getting yourself screened privately or outside of the NHS, because the NHS doesn't know that you are 50 because
yeah,
you
yeah.
told them you're 38. They'll take what you've written down.
Yeah, absolutely. The other thing, the NHS isn't the police either. I've had people who have come in and they are concerned about the implications of what they're saying. Or if I
Mm,
say this and this, if I say that and that. So as a doctor, I'm not interested in any of that. I'm interested in making sure that you get your health checked properly. So absolutely, if you don't feel you can divulge the truth, then do what Dr. Zainab is saying and engage in private screening, or maybe come to the doctor and say, this is what happened when I came into the country and
yeah.
where I am and can I have some help? I would be shocked if there was a negative outcome from,
Hmm.
from that. I would expect there to be a positive health outcome. So this is the last question that Zainab. Thanks for this presentation. Please could you throw insight into heat stroke?
Okay, so heat stroke is different from what we have talked about today. What we talked about is brain stroke, the common what like the common stroke. When we say stroke, when we're referring to stroke that is happening in the brain, it's like a neurological deficit we're talking about here, not heat stroke. So it's totally different from this conversation, and I wouldn't want to talk about that here because it's a different topic. But what you can do is do it could confuse people as well, like Dr. Alatia just gestured. So what you can do is just check heat stroke under patient and info. So NHS patient info has a lot of insights on different conditions. So you could just search that in NHS patient info and get more about it. But it's
Absolutely.
totally different.
Yeah. I mean, that Dr. Zainab mentioned before, so you might not have noticed she corrected herself. You said check online. No, no, do this. So the problem with the internet is that anybody can put anything. So as much as we would both advocate that you take responsibility for your health, part of that is vetting information.
Yeah.
So you want to go to a site that is reputable. The NHS is reputable because anybody, I could put a site today to say, oh yeah, the cure for stroke is peanuts. I could do that. And, maybe because of people in the world who want to believe that, it will get traction. So you want to, because you are taking responsibility for your health, part of that responsibility is vetting the information that you take. So I've got another question. Where can one check BP free without going to one with BP? I suppose there's 2 points to that question. My question would be, why wouldn't you want to go to your BP? But I'll let Dr. Zainab answer that question.
Okay, so yeah, like twofolds, yes, like you said, but I mean, I can understand why one may not want to go to their GP. Maybe they just want to check their blood pressure within their community, or they're just acutely concerned, and it's a Saturday or it is Sunday, and their GP probably isn't open. So you can actually find a pharmacy that offers free blood pressure checks using the link I shared in the chat. I have answered your question, Iyabo, with a link. So if you're above the age of 40 and you live in England and you don't have a current diagnosis of hypertension or cardiovascular disease, you can actually get a free blood pressure check at your local pharmacy. But I know that not all pharmacies offer this service, so you can use that link to check. So it's www.nhs.uk/NHS services, pharmacies. Find a pharmacy that offers free blood pressure checks, and then you can find one. So you put your postcode and it brings up all the pharmacies around you that provide free blood pressure checks for you.
I would also like to piggyback on that, and there are so many other tools. I mean, there was a time when the concept of having a home blood pressure machine was, it was only for rich and famous people. You can buy them on Amazon now, so you can do that. Even the technology that we have, my watch can measure my blood pressure. So if you're interested in that, these are things that you can engage in. And again, the issue is for me, the trend is more important than the actual number. So this has been a fantastic event. Dr. Zainab, I want to thank you. My last word would be, guys, this is your life. This is your life, and our strong encouragement to you is please take responsibility for your health. That's what I would say. Dr. Zainab, do you have a last word to encourage people with, or to leave people with before we hand over to Tricia?
If it's a last word, the last word will be fast. Just a word, fast.
Fantastic. So thank you so much, Dr. Zainab. We really appreciate your time and expertise.
Thank you so much.
Really, really, really educational and entertaining. So Tricia, we're going to hand over to you to close the session. Thank you, everybody, for watching.
All right. Thank you, everyone, for joining us today. And thank you to Dr. Zainab and Dr. Ayo for your presentations and answering the questions in the chat. I hope that today has been helpful to everyone who attended. So I'm just going to share my slide. If you could just bear with me for a few minutes, just a few upcoming events and webinars that we're having here at Khan. Just bear with me a few minutes while I bring that up. Yeah, so can you let me know if you can see my screen? Okay, can you all see my screen?
Yeah, but there's like a gray thing on it. Okay, it's clearing up now. Go ahead. We can see your screen. Thank you.
Okay, that's great. Yeah, so we have our next health hour, which will be on breast cancer and early detection. So that's next week, Saturday, same time as today. So if you can please scan the QR code to register for it or email info@Khan. Yeah, we hope to see you next week. And we have our speaker, Dr. Catherine Mbima, Director of Public Health at Lewisham Council. So it's going to be an exciting session and we hope to see you there. Feel free to take a screenshot of any of the slides that I share, just so that you can share within your network. Yeah, and then as you all know, we're part of the all-party parliamentary group Black Health, and we're calling for evidence of reproductive equity and fibroids crisis. So if you could please scan the QR code, there's more information there on how you can get involved. That would be great. As usual, feel free to screenshot it and share it within your network. Okay, and then one of our flagship events is coming up very soon. This year is really running quickly. So just next month on the 21st of June, we're having our Windrush celebration at the Alexandra Park, and it's just going to be bigger and better than before. So come with expectation to enjoy our Caribbean food, music, arts, anything you can think of. Just bring your friends. We are having a lovely weather now. I mean, today it's raining, but over the past few weeks, we've seen summer coming and it's come earlier than usual. So we're hoping that we're going to have a full-blown sun on that day. So please come with your family, your children, your friends, your neighbors. Just come and enjoy Windrush with us on that day. And yeah, feel free to register scanning the QR code. It's a free event as well. Let me just add that. If you also have a business or you're an organization, you're looking to share your products or your services, we have store opportunities available for you. So feel free to scan the QR code and yeah, just make that inquiry about how much it might cost for you to have a store. But it will be an amazing opportunity for you to also showcase your business or your organization, depending on where you're joining from, and just get as many people, as much reach as you can, just to grow your business or your organization's presence. Yeah, and then we also have our Black Healthcare Awards. So our tickets are now available. It's back on the 12th of July. So scan the QR code for more information, just to secure your ticket and also to nominate people. Yeah, and we also have our next home office session. So as you may know, Khan has partnered with the Home Office to organize webinars on immigration issues that may be beneficial to people in our community. So this time we're talking about the Windrush Compensation Scheme. So if you want to know more about the Windrush Compensation Scheme, please feel free to scan the QR code or email us at advocacy@khan.org.uk for more information. But it will be an informative session as well, because a lot of people who have been affected by Windrush do not know that there's a compensation attached to it. So do not miss out on this opportunity. If you know someone who may have been affected by windrush and you're not sure about how to claim the compensation, please send them this link or screenshot it and send it to them as well. Yeah, so that's all for today. Thank you so much for joining us this afternoon. And yeah, I hope you enjoy the rest of your weekend.
Welcome to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CARN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carn.org.uk.